Item 2 is our COVID-19 weekly update from Public Health. We do have Becky with us on Teams. There she is. Make sure that
Good morning, commissioners. Can you hear me okay?
We can. I just want to get a nod that the microphone is picking it up correctly. Is that broadcasting, Steve?
We should be good, Madam Chair.
Okay, we are good, Becky.
Great. And then Steve, if you're able to pull up the PowerPoint.
Should be.
We were seeing it. I think he just needs to share the screen. He's working on it.
Okay. Technology is great.
Can you see it, Becky?
I cannot, no.
Okay, it is up, so we can see the weekly reported cases. I think Steve's gonna work on trying to screen share that, but if you want to just give verbal cues to change the page, he can do that so we can start.
Sure, let me just pull it up on my end so I know what we're looking at. Okay, so the first slide here is our weekly reported cases. And again, this is reported by date of sample collection, so the date that the person was tested. And really at this point in the pandemic, we spoke about this last week too, but this is the most accurate way for us to report our cases now for a couple different reasons. One being that there's so much lag in reporting, and the other being that there's such a variation too in the amount of time that people are in isolation. So some people, you know, they're in isolation for 5 days, other people it's 10 days. So this is really our most accurate way right now. So you can see for Clay County, for the week of the 16th to the 22nd, we had a little over 1,000 new cases. Of note, last week at the board meeting, we had reported 394, so it's more than doubled, almost tripled that number as the reports or the data has caught up. And then for last week, the week of the 23rd, there were 597 new cases reported. Again, that is a preliminary number, and we expect that number to go up. Statewide for Minnesota, the week before last, there was over 62,000 new cases, and last week we had reported 8,900. So a huge jump in the numbers as the numbers catch up. And then as a preliminary number for last week for the state of Minnesota, we had 17,111 new cases. For Cass County and North Dakota, it does look like cases have maybe are starting to trend downwards. So we're hopeful that maybe we're over the peak and you know, we'll start to see cases go down. Then you can go to the next slide.
All right.
And then this is the reinfection data. So again, you know, we anticipate these numbers to go up every week. So for Clay County, we've had 687 reinfections, statewide 47,710. And then for the state of North Dakota, 9,800. And again, a reinfection is defined as someone who's tested positive with COVID and then winds up getting reinfected, you know, 90 days later, or at least 90 days later. And next slide.
Okay.
And this is our Clay County cases reported per week, just going back to August 1st of last year. So you can see we had a really huge spike of cases starting beginning of January. Again, hopeful that maybe the week of January 9th, where we had over 1,400 cases, that was the peak of this Omicron wave. But again, time will tell if that trend continues. A little over 1,000 cases reported the week before last. And then again, 597 for our preliminary number last week. And that's why that bar is shaded gray. Next slide. This is our epi curve throughout the entire pandemic. So starting out with our first case back in March 15th of 2020, going all the way through last week. So you can really see the defined spikes of cases that we've had, and then really just that huge increase of cases in January. Next slide. This is Clay County cumulative cases broken down by age. So we've had a total of 17,574 cases reported in Clay County. And again, that age group of 20 to 24 is where we've seen the most amount of cases reported. Lines. All right, and this is the CDC level of community transmission. I think it probably goes without saying that we're still in a high level of transmission in Clay County and throughout the whole state of Minnesota. Next slide. This is Clay County deaths per week. We did unfortunately have another death reported. So we've had a total of 116 Clay County residents that have died due to COVID throughout the pandemic. Slide. Should just ask, is everyone still able to hear me? Okay, I can't see the presentation,
Yeah.
so I'm.
No,
Okay.
you're doing a great job. We are now on the Clay County Hospital admissions per week slide as well.
Perfect. Just didn't want to get too far ahead if we were not on the same page.
Oh, we're good. Thank
So
you.
this is the Clay County hospital admissions per week. As you can see, we saw a pretty large increase in the number of admissions the week before last. At 31 admissions, and then so far for last week, 21 admissions. So, you know, concerning and something that we're definitely keeping an eye on, but also expected. So, you know, typically anytime we see a large increase of cases over the next 2 to 3 weeks, we'll see an increase in admissions. And this is the hospital capacity information for our healthcare systems in Fargo. So at the time of this report, there was 8 available staffed ICU beds, and 1 staffed pediatric ICU bed available at Sanford in Fargo. Statewide totals available adult ICU beds were at 15, and available pediatric ICU beds were 2. Next slide. This is COVID hospitalizations in North Dakota. So a total of 184 currently hospitalized. That is up a little bit from last week. I think it was 164 last week, but the number in the ICU has remained the same. Currently, there are 2 pediatric patients hospitalized, North Dakota residents that are pediatrics that are hospitalized. And then the graph on the right, again, is just the cumulative hospitalized broken down by age. This is the vaccine breakthrough reports that MDH puts out weekly. So you can see side-by-side comparison of last week, our cumulative percentages compared to the most current data that we have on the right-hand side. So as anticipated, the breakthrough cases are going up a little bit. So 8.388% breakthrough hospitalizations and deaths really are not moving, which is what we're looking for. So those remain low. Again, main message here is that these vaccines are working incredibly well, preventing serious illness in people. Next slide. This is the charts that I showed last week that MDH puts out. Really just a fantastic visual at the difference in COVID deaths that we're seeing in Minnesota. So the blue line is those that are not fully vaccinated. The green line, which you're not really seeing moving much, is the people that are fully vaccinated. Mm-hmm. So the majority of deaths that we're seeing are in those that are not vaccinated. This is just kind of an informative slide that I included this week because we get a lot of questions about variant distribution in Minnesota. And so as you can see, Delta really was the predominant variant starting last summer in June, and saw that huge wave of Delta cases up until recently. And then Omicron very quickly took over as the predominant variant. So for the first 2 weeks in January, 90% of COVID samples that were sequenced were the Omicron variant, and still seeing about 10% of those sequenced are Delta. So seeing both variants circulating, but Omicron by far is the most prevalent.
Becky, can we take a pause really quick? I think there might be some. First of all, thank you for including that. That is, as you stated, an excellent diagram. Commissioner Cayley.
Yeah, Becky, there's a blue line that runs through the middle of that chart. What's the blue line supposed to signify?
You know, I'm actually not sure. I think it's a trend line, you know, for number of reported cases. So it should kind of line up with the waves that we saw. But I would have to double check to see about that.
Thanks.
Any other questions on that? You can continue, thank you.
So the next slide is our statewide vaccine data updated as of the 27th January. And this includes those that are ages 5+. So people with completed or people that are fully vaccinated statewide, the percentage is at 69%. Again, our vaccine data is for Clay County is likely underreported, but from what we do have, we're showing a little over 60% of those over the age of 5 are fully vaccinated. So we are running a little lower than the statewide percentages. And then we've had a little over 2 million people that have gotten their 3rd dose or their booster. This is the amount of COVID vaccine doses given out by Clay County Public Health per week. So we've done 19,104 doses to date, continuing to kind of see a decrease in the number of doses that we're giving out per week. So last week we had just 45 doses that we gave. Right. So this is breaking down those 45 doses into what they were for last week. So we had 2 first doses, 3 second doses, and then 30 third doses or boosters. Pediatric vaccines, we just gave out 1 first dose and 9 second doses. Next slide. And then in terms of our vaccine clinics for this week, we do have 2 tomorrow at the Family Service Center. So tomorrow, Wednesday the 2nd. Our first one is 11 to 1. And that's a clinic for those ages 12+. So Pfizer first, second, and booster or 3rd doses are available for those 12+. And then also offering Moderna first, second, and booster doses for those ages 18+. And then having a later clinic in the day for the pediatric doses, so ages 5+, giving Pfizer first and second doses for 5 to 11-year-olds, and then continuing with the Pfizer first, second, and booster doses for ages 12+. And again, if anyone ever has any questions about coming in for a flu shot or COVID shots or really any other vaccines, you can give us a call, and that's our vaccine hotline there at the bottom. And lastly, I just wanted to, I like graphs, so I put the weekly positivity rates for our vault test site into a graph just to make it maybe a little easier to see. So we don't have the numbers for last week yet, unfortunately, but you can see from the week of the 16th, really a very high positivity rate at, I think it was 27%. So that's a really good indicator for us to know what's going on in the community. You know, as we start seeing the positivity rates go down, we can be fairly confident that we've peaked and that trend will stay. So we'll just see, you know, as the data comes in for last week, where we're at with that. And then total tests administered at the Moorhead site is 98,639. Great.
Thank you so much, Becky.
Any questions?
Any questions on this piece? Commissioner Kaylee has a question.
Yeah, Becky, back on the first page of the weekly reported cases, you had 597 for our preliminary number for Clay County. And the last 3 weeks, that number has more than doubled as the data has caught up. Do you feel like we're still in that trend with the data lag, that it'll probably double, maybe more than double again?
You know, it's really hard to say. When we had our meeting last week with the Minnesota Department of Health, they are slowly getting caught up, you know, with this data lag. So it's really difficult for me to give you a for sure answer. You know, I anticipate that number to go up as it always does. Whether we're going to continue to see this trend of it doubling or almost tripling every week, I hope not. But I will plan on, and I did this last week too, later in the week, so on Thursday or Friday, running another reports and then updating the numbers that I did, at the beginning of the week. So hopefully that can help give a clearer picture later on, after the numbers have had a little bit of a chance to catch up.
Thanks, Becky. That was really helpful on Thursday to get some more perspective on that.
Yeah, you bet.
Commissioner Cayley, thank you. Commissioner Campbell.
I just wanted to point out that on the Clay County cases per week graph that is just behind what Commissioner Cayley just asked about, there seems to be some positive news in final numbers between January 9th and January 16th. Those numbers are final, and they went from 1,465 to 1,025, so that is encouraging. So hopefully these numbers are correct in that 597. We are catching up, and it would sure be nice to see that somewhere under 1,000 anyway, to see we're going in the right direction. Just to point that out, that we basically 1/3 less from the 16th, from the 9th to the 16th. They're still big numbers, but hopefully that peak has happened in Clay County. So.
Can I just ask a clarifying
Kaylee.
question? Commissioner Campbell just said that's a final number. I didn't pull my chart out from last week, but I kind of thought that where it now says 1465, that was 1390 last week. So maybe there is like a few more that trickle in a couple weeks late. Is that accurate, Becky?
Yeah, we are seeing that more so now than before. Usually there'd be, when you would go back maybe 2 weeks, you would see a little bit of a trickle upwards, and now that has been stretched back a little farther. So, again, I hope that as numbers go back down, we don't see that lag. But yeah, you really shouldn't see too much variations, 2 weeks previous.
Anything else? Becky, in regards to, I'm maybe skipping ahead a little bit, but talking about the positivity and having had significant conversations with the governor's office and MDH regarding that Volt site and testing. I know that the rapid test is a great one to have, but really it's not the gold standard like the saliva. And are you seeing, sorry if there's feedback, are you seeing people go in for the rapid, maybe getting a positive, and then going over to submit the saliva test in the same session?
I guess I can't speak to that for the most recent weeks. That would be typical to what we had been seeing, beforehand, where people will get results on the rapid test and then want to go out and confirm it with a PCR or saliva. I think we're trying to steer people away from that, particularly if you test positive on the rapid and you're having symptoms. We really want you to go with that positive test. Just there's not enough testing to go around as is. So once you get a positive, there really is no reason to confirm that. Does that answer your question? Did I understand correctly?
You did, and I think for those of us that are trying to read the data weekly, it's hard if obviously the strains are much more prevalent right now. We all know that, but in terms of what these numbers are, it would be nice to know what the unduplicated number is. And I don't think that's a number we even can grasp, but I think it's important that we also maybe are aware that that's happening. Do you want to move into the Volt information? Do you have that, Becky?
The handout?
Yes.
I don't have that handy right now.
That's okay. I can maybe walk through it if, I know the entire board has it, but I think for the public. During the last given information that we have would be that week of the 16th, January 16th. So the number of tests that week conducted total were 2,796. The positive results, 769 of those were positive, moving that positivity rate to 27.5. I think that it is helpful to see that from the beginning of January, we're upwards of more than 1,000 more than where we started at the beginning of January. I think there's probably still substantial need out there for availability for testing. And then the information that we have in terms of the saliva and the rapid haven't been updated, so that's the same as what we've had in weeks prior, but anything else? Maybe now's an appropriate time, Steve, to talk a little bit about the response from Minnesota Department of Health to our letter for Vault.
Thank you, Madam Chair. As the board recalls, here a couple of weeks ago, this board approved a letter to go along with the City of Moorhead officials to the governor's office, Commissioner Jan Malcolm, and also our representatives. Commissioner Mojo and Mayor Carlson, along with Kathy McKay, had some ongoing conversations with the governor's office and MDH office. I think the response that we received probably didn't meet the expectations of what we were hoping for. The response, they did provide some responses, which I think were to coordinate some of home testing that has becoming available, continue to utilize Cass County's facility, which we know is not something that currently Cass Public Health is wanting us to utilize. As part of the discussion, it was shared that the executive of Vault was going to be coming to Moorhead to see how things were being done firsthand. It's our understanding that the person did come to town, but unfortunately did not coordinate with any of our officials here within the city and county, and so that was disappointing. Kathy McKay had requested a meeting with the state officials and also the Vault executive, and at this point that meeting has not taken place.
Thank you. As a follow-up to that piece, Representative Heather Keeler and I had a meeting on Tuesday evening of last week with the governor's office, but also with Commissioner Malcolm's office, to state the same position, to advocate for flexibility in the hours. If they weren't going to provide more hours, let's provide some early morning options. Their comment was that they're hoping to switch a little bit more from community sites being a mitigation tool to community sites being a testing option for people exhibiting symptoms. And I did receive a follow-up email last night from the governor's office to maybe talk a little bit about what this official that came to town would suggest. So I believe Representative Keeler and I will have a follow-up meeting in the next day or two to advocate for increased collaboration with the locals on the ground. Any further questions? Right. Becky, thank you so much. We appreciate you tuning in.
I did have a couple other quick updates,
Yes.
if that's okay.
Yep.
We did receive a shipment of 10,000 KN95s that we're able to distribute to the public. Our first priority is developing a distribution plan to really get these out to community members that may have barriers to access. So we're currently working on that. But also anyone from the general public is able to stop by our public health clinic on the first floor and pick up some KN95s for use. So I just wanted people to be aware of that. You can certainly call or email with any questions about that as well.
Thank you, Becky. I appreciate that we received that shipment. I would encourage you to coordinate with the social or the senior service centers or the senior centers in Clay County. I know that they serve a population that wouldn't necessarily make it up to Moorhead. I know that Robin Christensen from CAP LP would be a great contact to talk about some vulnerable population. And I think, Rhonda's sitting in here nodding. We our departments work with enough folks that may be isolated, that we can connect to get those masks. Any other questions? All right, anything else?
And then, yeah, the other update I had is that Kathy and I met with the CMOs of Sanford and Essentia on Friday. So it was really helpful just to kind of get an update from our local healthcare systems about COVID. You know, they both agreed that their biggest challenge is really having enough staffed beds, which is no surprise to us when we look at our hospital capacity data. And, you know, they're seeing about a third of their current inpatients are COVID positive. And so certainly not, you know, the burden of COVID is very real. It's not the only burden out there, but it is putting a pretty big strain on the hospital systems. They mentioned that many COVID patients have a very long, tough recovery after being discharged from the ICU and can be, you know, hospitalized for weeks and weeks afterwards. And the other thing that they brought up is there's a very, very limited supply of the monoclonal antibody treatment. So with Omicron, there's currently only one drug that is effective against Omicron, and that's in very short supply. Sanford said that they have a wait list of over 100 people waiting to get that. They will be having another treatment, a shipment come in, remdesivir, but it is not as easy, I guess, to give out. So it's given via IV over 3 days. So it's not quite as simple as the you know, the infusion of monoclonal antibodies. So.
Thank you, Becky. Commissioner Kaylee.
Becky, in that conversation with the CMOs, you know, when you share the hospital capacity with us, this is like a moment in time. How did you talk about how that's fluctuating over the week? I mean, I'm sure there are times when they are full or times when they have a little bit more space. Did they talk about that at all?
They did, yeah. I mean, it's really hard to share the hospital capacity because, like you said, it is just a snapshot in time. So it kind of goes up and down, you know, depending on the day. They did say they have not had to implement any crisis standard of care yet, so that is good. They are starting to see the number of staff out as of late last week. You know, is not as bad as it had been in the previous 2 weeks. So we're hopeful that you know, the capacity will increase over the next week or so.
Thank you, Commissioner Kaylee. Commissioner Campbell.
Becky, can you explain the difference between the monoclonal, what I think is what you called it, versus what I always knew as plasma? Is there a difference in those?
There is. So the monoclonal antibody infusions that we talk about are antibodies that are generated in the lab, so they don't actually come from an infected person, whereas the plasma is taken directly from the blood of a person that has been infected. And to my knowledge, I think it's been shown that the monoclonal antibody treatments have been more effective than plasma.
So if it's created in the lab, why they can't produce that in large quantities then, or why is there such a shortage of that?
You know, I guess I don't have a clear answer for that. Part of the problem is that there were 3 or 4 different monoclonal antibody treatments that worked for Delta and for previous variants, but there's only one currently being made that works against Omicron. So I think that's just added to the supply chain issues. There's just not enough of it to go around, and it takes time to synthesize it.
So one final question, going back to the plasma. The plasma is still an effective treatment that's used?
You know, I know that it is used still. I'm not sure to what capacity. The last I had heard is that it's maybe not as effective as the monoclonal antibodies have been, but I can look more into that and get you a more direct answer.
I know early on, before the monoclonal was even available, plasma was a critical one, and we had called for people to donate. And I'm just curious if that's still something that should be encouraged. Right? So maybe you can follow up with us on that.
I'll follow up with that.
Thank you.
Yes.
Thank you. Any further questions? Any further questions? Thank you for your report, Becky.
Yes, you bet. Thank you.